The theme of our lesson, of the lecture, general anatomy of veins, development of cardiovascular system, and characteristic of blood supply of the fetus. Last lecture we have discussed about the cardiovascular system, about the heart, arteries. Cardiovascular system consists of the heart and vessels. The vessels of cardiovascular system presented by arteries, microcirculatory bed, and veins. Veins pass the blood to the heart. This is heart. We have the superior vena cava, inferior vena cava, and the veins pass the blood, deoxygenating blood, to the heart. Functions of the veins. First, veins return deoxygenating blood from organs to the heart. Veins reservoirs the venous blood. Veins regulate hemodynamics. Veins participate in exchanges between blood and tissues. These are functions of the veins as part of the cardiovascular system. The endothelium of the veins have many receptors. The receptors located in the veins walls: mechanoreceptors, chemoreceptors, thermoreceptors, and baroreceptors. And between the vessels may be reflexes, veins reflexes, vein arterial reflexes, vein lymphatic reflexes. The endothelium of the veins have many reflexes and many receptors. The factors of centripetal blood flow. The contraction of muscular coat of the veins. The veins valves. The contraction of skeletal muscles. The section action of the heart and negative chest pressure. The differences in blood pressure between arteries and veins. Veins as arteries have muscular coat, contraction of the muscular coat. Veins has many valves, contraction of the skeletal muscles, section action of the heart, differences between the pressure inside the arteries and veins. In this picture we can see the valves of the veins valves. This have the pocket shape and direct the blood only along the only one direction, to the heart. They are parallel to each other. This is veins. The structure of the wall of the veins, like to the structure of the arteries. Inner endothelium, endothelium, then thin muscular layer, and adventitia. Now what this is artery, this is veins. The muscular layer of the veins is just very thin. Then the muscular layer of the artery. Blood direction into the veins. We know the blood capillaries. It is part of the microcirculatory link. Then blood capillaries continuation into the post capillaries into the venules. From the venules formate the intraorganic veins, then extraorganic veins of the small caliber, veins of the middle caliber, veins of the large caliber, and large veins. This is outflow of the venous blood from the organs, originates from the post capillaries and inside the large veins. This is venous direction from the tissue of the organs till large veins. The principle of organization of the venous system is convergation. Artery subdivides into the branches. Veins form from tributaries. This principle, it is divergation, convergation. The veins formate from the many tributaries. Two exceptions from these convergation rules, the portal vein of the liver and the portal vein of the adenohypophysis of the brain. Two exceptions from this rule. The main principle of the arterial system, it is divergation principle. The artery subdivides into the branches. Veins form from tributaries. Here two exceptions from them, portal vein of the liver and portal vein of the adenohypophysis of the brain. Here we can see the portal vein of the adenohypophysis. This is hypophysis, anterior part called adenohypophysis. You what hypophyseal veins inside the adenohypophysis subdivided into the many branches. These branches formate the veins, and the venous blood exits from the adenohypophysis. It is exception from convergation rules. Then we will discuss about the artery and parallelly discuss about the veins. Artery and veins lies inside the neurovascular bundle, and first we will discuss about the arteries. Aorta, it is the biggest artery of human body, originates from left ventricle of the heart, has three parts for the topographic position: ascending aorta, aortic arch, descending aorta. Aortic arch surrounds the left principal bronchi. Descending aorta down left side from vertebral column, direct exit through the diaphragm from the thoracic cavity into the abdominal cavity. At the level of the L4 vertebra, descending aorta subdivides into the right and left common iliac arteries. aorta, it is very important, main, biggest artery of the human body. Originates from the left ventricle, has 3 parts. For the topographic position, surround the left principal bronchi. Descending aorta have thoracic part and abdominal part because they down through the diaphragm. At the level of the fourth lumbar vertebra, descending aorta continues into the right and left common iliac arteries. What we can see the aorta, this is heart. Aorta originates from the left ventricle around the left principal bronchi. This is ascending aorta, this is aortic arch, and descending aorta. Descending aorta continues into the right and left common iliac arteries. Aorta, it is important vessel of the systematic circulation. Topographic position, we can see the trachea subdivided into the right and left principal bronchi. This is aortic ascending aorta. This is aortic arch. It continues into the thoracic descending aorta and abdominal descending aorta. We can see the bifurcation of the aorta. Branches of the aortic arch. First, from the right side, bronchopulmonary trunk. It is 5 centimeters long, subdivided into the right common carotid and right subclavian artery. The second branch, it is left common carotid artery and left subclavian artery. These are branches of the aortic arch. Here we can see them on the picture. This is aortic arch from the right side. This is brachiocephalic trunk. From the left side, left common carotid artery and left subclavian artery. Here brachiocephalic trunk subdivided into the right common carotid and right subclavian arteries. These are 3 branches of the aortic arch. 3 branches of the aortic arch. Here what we can see the arterial system of the human body. What aorta, just the main biggest artery. It's subdivided into the brachycephalic trunk subdivided into the right common carotid artery, right subclavian artery, left subclavian originates from the aortic arch, and left common carotid, left subclavian artery. Arteries of the upper limb. Subclavian artery continues into the axillary artery, into the brachial artery, brachial subdivided into the radial and ulnar artery. Brachycephalic trunk give subclavian artery, subclavian into the axillary into the brachial subdivided into the radial and ulnar arteries. Here what axillary artery lies near the axillary fossa. Here this axillary artery, blood supply, bones, joints, muscles of the pectoral girdle, shoulder joint, superficial muscles of the thorax, fascias and skin above them. This is function of the axillary artery. Blood supply the bones, joints of muscles of the pectoral girdle, shoulder joint, superficial muscles of the thorax. Then we can see the brachial artery, which subdivides into the ulnar and radial artery. This is brachial artery, and on the anterior surface of the elbow joint, it subdivides into the radial artery and ulnar arteries. Function of the brachial, radial, and ulnar arteries. They blood supply bones, joint, muscles of the brachium, forearm, and hand, elbow joint, wrist joints, and joints of the hand, fascias and skin above them. These are functions of the brachial, radial, and ulnar arteries. They blood supply the three upper extremity, bones, joints, muscles. On the palmar surface of the hand, we can see the superficial and deep palmar arteries. What next lecture we have discussed about the art form anastomosis. On the palmar surface of the hand, we have superficial palmar artery and deep palmar artery. What radial artery, or ulnar artery and radial artery, by their branches form the superficial palmar artery and deep palmar artery. Veins can be divided into the two groups, somatic veins and cavity veins. Somatic veins of the extremities, cavities veins, such as veins of the thoracic cavity, abdominal cavity, pelvic cavity. There are two groups veins of the extremities, superficial veins and deep veins. There are two kinds of veins, two types of veins on the extremities, on the upper and lower extremities, superficial veins and deep veins. Superficial veins of upper and lower limbs collect the venous or deoxygenated blood from the skin, subcutaneous fatty tissue, and superficial fascia. They flow into the deep veins only in a certain place. These are superficial veins. They collect the venous blood from the skin, subcutaneous fatty tissue, and superficial fascia, and lies between the skin and superficial fascia. When you look to the skin of the upper extremity, you can see the superficial veins. There are two superficial veins on the upper limb. First, it is cephalic vein. Cephalic vein originates from superficial veins of the thumb, then directs along the lateral surface of the upper limb and flows into the axillary vein near the axillary fossa. First vein, it is cephalic vein. Second vein, superficial vein, this is basilic vein, originates from the superficial veins of the fifth finger, или digital minimi, flows into the one of the brachial veins near the elbow joint. There are superficial veins of the upper limb, cephalic veins, and basilic veins. We can see them on the picture. Superficial veins of the upper limb, cephalic and basilic veins. But from the thumb, direct the cephalic vein, that's along the lateral surface of the forearm, arm, and flows into the axillary vein. From the digital minima, originate basilic vein, lies along the medial surface of the hand, forearm, and flows into the one of the brachial veins. Longest it is cephalic vein, shortest it is basilic vein. And deep veins, function of the deep veins. Deep veins collect the venous blood from bones, joints, muscles, and deep fascia. They lie inside the neurovascular bundles of the limbs. Veins of the upper limb, leg, and foot are paired to one artery, correspond to veins. The deep veins collect the venous blood from the vein bones, joints, muscles, and deep fascia, lies inside the neurovascular bundles of the limbs, and veins of the upper limb, leg region, and foot have to one artery correspond to veins. Two veins inside the neurovascular bundle. Outflow of the venous deoxygenating blood through the deep veins of the upper limb. We can see the direction. Deep and superficial venous arteries flow the venous blood into the perigee radial and perigee ulnar veins. They flow into the perigee brachial veins, into the anterior axillary vein, into the subclavian into the brachycephalic vein, and superior vena cava. This is outflow of the venous blood along the deep veins of the upper limb. Deep superficial venous arch, radial and ulnar veins, brachial veins, axillary vein, subclavian vein, brachycephalic vein, and superior vena cava. Superior vena cava flows into the right atrium of the heart. What we can see the deep veins of the upper extremity on this picture. From the hand, superficial and deep venous arch, two ulnar veins, two radial veins, two brachial veins, anterior axillary, subclavian, brachycephalic, and superior vena cava. Arteries of the lower limb. Abdominal aorta continues into the common iliac artery, right and left common iliac artery, common iliac artery into the external iliac artery, external into the femoral artery, femoral into the popliteal artery subdivided into the anterior and posterior tibial arteries, and on the foot formed the plantar and dorsal arterial arteries. These are direction oxygenating blood along the arteries, from the abdominal aorta to the foot. Here we can see them on the picture. First, common iliac artery into the external iliac artery, then external iliac artery into the femoral artery. This is femoral artery. Femoral artery continues into the popliteal. Popliteal lies behind the knee joint. Popliteal artery subdivides into the anterior and posterior tibial arteries. Anterior tibial artery and posterior tibial artery. On the foot, we have the dorsal and on the plantar surface, plantar arterial arteries. Plantar arterial arteries. Superficial veins of the lower limb. On the upper limb, we have cephalic and basilic veins. On the lower limb, we have two veins. Large saphenous vein originates from superficial veins of the first finger of the foot. It just lifts along the medial surface of the lower limb and flows into the femoral vein. Значит, вена сафена magna или large saphenous vein. Second vein, it is lesser saphenous vein, vena saphena parva. Vena saphena parva originates from superficial veins of the fifth finger of the foot along the lateral surface of the leg and flows into the popliteal vein. This vena saphena magna like to the cephalic vein. Vena saphena parva, a lesser saphenous vein, like to basilic veins of the upper limb. Outflow of the venous blood through the deep veins of lower limb. We can see the venous outflow from the dorsal and plantar venous arch. The venous blood can flows into the parietal, anterior and posterior tibial veins into the anterior popliteal, popliteal into the femoral into the external iliac into the common iliac, and into the inferior vena cava. These are outflow of deoxygenated blood through deep veins of the lower limb. The arteries and veins of the cavities subdivide into the parietal arteries, parietal veins. They blood supplies the walls of the cavities. The arteries blood supply the walls of the cavities. Our veins collect the venous blood from the walls of the cavities. And two group at the visceral arteries and parallel veins. They visceral arteries blood supply the organs. Visceral veins collect the venous deoxygenated blood from the organs. There are parietal and visceral vessels on the inside the cavities. There are three main venous system. First, it is superior vena cava. It is reservoir the venous blood from the organs of the head, neck, thoracic wall, and organs of the thoracic wall and upper limbs. It is function of the superior vena cava. Venous blood from the organs of the head, neck, thoracic wall, and organs and upper limbs. Inferior vena cava system, reservoir the venous blood from the abdominal walls, perich organs of the abdominal cavity, kidneys, suprarenal glands, testes, all ovaries, liver, pelvic walls, and urodental organs and lower limbs. This is the function of the inferior vena cava. That abdominal walls, kidneys, suprarenal glands, testes, ampere liver, pelvic walls, and urodental organs and lower limbs. The third main venous system is portal vein system. Значит, it's collect the venous blood from unpaired organs of the abdominal cavity. Unpaired organs of the abdominal cavity. Abdominal cavity. What we can see the superior vena cava. Superior vena cava. It is collect the venous blood from the head and neck, from the upper extremity, and from the thoracic cavity and organs of the thoracic cavity. Superior vena cava. Superior vena cava formed from two tributaries, left brachycephalic vein and right brachycephalic vein. What the aorta give the brachycephalic trunk. It corresponds the brachycephalic veins. Each brachycephalic veins forms from the internal jugular and subclavian vein. Subclavian vein. What we can see the superior vena cava, tributaries of them, right brachycephalic, left brachycephalic vein, each brachycephalic from internal jugular and subclavian veins. Subclavian veins. Here we can see the inferior vena cava and superior vena cava. This is superior vena cava. It's formed behind the manubrium of the sternum. Manubrium of the sternum. Inferior vena cava, this one, formed from the right and left iliac, common iliac veins, and lives along the vertebral column through the diaphragm and flows into the right atrium. Right atrium of the heart. What we can see the abdominal aorta and parallel inferior vena cava. Inferior vena cava. Superior vena cava, as it forms behind the manubrium of the sternum from right and left brachycephalic veins. Each brachycephalic vein forms from subclavian vein and internal jugular vein. Subclavian vein and internal jugular vein. Inferior vena cava forms from the right and left common iliac veins at the level of the fifth lumbar vertebra. Lumbar vertebra. Portal vein. Portal vein reservoirs the deoxygenated blood from unpaired organs of the abdomen. These are stomach, small intestine, spleen, pancreas, gallbladder, large intestine before middle one third of the rectum. The portal vein collects the venous blood from unpaired organs of the abdominal cavity. And portal vein directs into the porta hepatis, in the porta of liver, in which venous blood clearing inside the hepatocytes of the liver, and from the liver exit for hepatic veins, which flows into the inferior vena cava. Inferior vena cava. Portal vein collects the venous blood from the unpaired organ of the abdominal cavity, direct into the porta of liver and inside the hepatocytes of the liver. This venous blood clear it. Tributaries of the portal vein. There are three tributaries: splenic vein, superior and inferior mesenteric veins. Superior and inferior mesenteric veins. What? This is the liver. This is portal vein. This is short vein, где-то 8 centimeter long. It's formates behind the head of the pancreas from the splenic vein, inferior mesenteric vein, and superior mesenteric veins. This is portal vein. Movable organs have the venous plexus. Inside the layers of the tubular or hollow muscular organ. The wall of the tubular or hollow muscular organ consists of 4 layers: internal mucosa, submucosa, muscular, and serosa or adventitia. И вот organs of the pelvic cavity, значит, urinary bladder, значит, rectum, maybe uterus, значит, around by very development venous plexus. They around the organ and lies inside the submucosa, muscular layer, and serosa, under the serosa. Значит, это venous plexus. И the vertebral column, значит, has 2 venous plexus, outer venous plexus and inner venous plexus. Outer venous plexus lies on the outside of the vertebral body and arch is subdivided into the anterior and posterior vertebral plexus. Inside the vertebral canal we can see the anterior and posterior inner venous plexus. There are many veins forming the anastomosis and venous plexus. The veins of the head and neck. The main vein of the neck, it is head and neck. It is internal jugular vein. Internal jugular vein connects with the subclavian vein, and behind the sternoclavicular joints formates the brachiocephalic vein. Internal jugular vein, значит, reservoirs the venous blood from organs of the head and neck. It formates from the sigmoid sinus of the dura mater on near the jugular opening of the posterior cranial fossa. It is internal jugular vein. Internal jugular vein collects the venous blood from the organs of the neck and head and formates from the sigmoidal sinus of the dura mater of the brain. Tributaries of internal jugular vein subdivide into the 2 groups. Значит, intracranial tributaries and extracranial tributaries. Intracranial and extracranial tributaries. Intracranial tributaries, значит, veins of the head reserve the venous blood from the brain, meninges of the brain, and eyeballs. Intracranial veins collect the venous blood from the brain, meninges of the brain, and eyeballs. and eyeballs. Here we can see the outflow from the brain. The duramet of the brain have the sinuses. The sinuses of the duramet. This is large veins inside the duramet. They do not collapse. Have now the valves. Have now the vessels. For example, we will study the superior sagittal sinus, parallel inferior sagittal sinus, between the rectus sinus. This is sigmoidal sinus. Sigmoidal sinus flows into the internal jugular vein. Characteristic or peculiarities of the sinuses of the duramet. The walls of the sinuses are composite of slightly stretched layers of the duramet. They never collapse. They have no valves. Here they provide the venous blood flow in changes of intracranial pressure. These are functions of the sinuses of the duramet. They have now the valves, never collapse, and from the sigmoidal sinus originate internal jugular vein. Anastomosis between the intracranial and extracranial veins. These are intravenous anastomosis. Face by means of the emissary veins, by means of the diploic veins, by means of the vena ophthalmica, which is ophthalmica vein of the eyeball, in venous plexus along the cranial nerves. Four types of the anastomosis: through the emissary veins, through the diploic veins, through the ophthalmic vein, and along venous plexus, along the nerves which exit from the cranial cavity, through the opening of the cranial cavity. There are four diploic veins. Frontal diploic vein, anterior and posterior temporal diploic veins, occipital diploic veins. These veins have longitudinal direction and lie between superficial and deep plates of bones of the roof of skull. Skull have the base and calvary or roof. The roof of the skull presented by thin plates of the frontal bone, parietal, temporal, and occipital bones. In between the deep and superficial plates of this squamous, lies the longitudinally diploic veins. Так. Сейчас, sorry. Так, there are emissary veins. There are three emissary veins. Это parietal emissary vein, condylar emissary vein, and mastoid emissary veins. These emissary veins lie inside the same name canals, for example, condylar canals, mastoid canals, или direct through the parietal opening of the parietal bones. These emissary veins formate anastomosis between the sinuses of the dura mater and superficial veins of the head. Так, next questions. Ой, sorry, сейчас my slide. Так, write please. Peculiarities of the blood circulation of the fetus. It is the questions of our lecture. We know the pulmonary and systematic circulation on the human body of the adult. What inside during the fetus of the fetus do not function of pulmonary circulation. If from placenta of the uterus originates umbilical vein. It's directs the oxygenating blood from placenta to the abdominal cavity. This umbilical vein flows into the portal vein inside the liver, portal vein into the inferior vena cava, inferior vena cava into the right atrium of the heart, and between the atriums the fetus have the oval opening. Through the oval opening from the right atrium, the venous mixed venous blood directs into the left atrium, then left ventricle, aorta nutrients the organs, and two umbilical arteries. It flows into the veins of the placenta. It is circulation inside the fetus. There is umbilical vein, then portal vein, inferior vena cava, foramen opening or foramen ovale, from the right atrium into the left atrium, left ventricle, aorta, umbilicals, arteries, and veins of the placenta. Так. Oxygenating blood mixed with the deoxygenating blood through the connections. That's umbilical vein by venous duct connects with inferior vena cava. Inside the umbilical vein, oxygenating blood. Inside the inferior vena cava, deoxygenating blood. Inferior vena cava have the arterial blood through the venous duct. Between right atrium of the heart and left atriums of the heart, the fetus have the oval foramen. Mixed blood from the inferior vena cava direct into the left atrium. Pulmonary trunk originates from the right ventricle. Vessels of the pulmonary circulation collapse, and pulmonary trunk connect with aorta by arterial duct. That's the characteristic of the blood circulation connections of the between the veins. Umbilical vein, oxygenating blood. Venous blood, the duct oxygenating blood mixes with deoxygenating blood inside the inferior vena cava. Inferior vena cava flows into the right atrium through the oval opening into the left atrium. From the right atrium, the venous blood directs into the pulmonary trunk. Pulmonary trunk subdivides into the left and right pulmonary arteries. No, it's not direct to the lungs because the lungs and vessels of the pulmonary circulation of the fetus collapse, do not function. The pulmonary trunk connects with aorta through the arterial duct. Then the next question is development of the heart. For the stages of the development heart, the heart has many shapes. First shape is a tubal shape heart. That's on third embryonic week. Then S-shaped heart. S for me, the S-shaped heart. Then this S-shaped heart subdivides by interatrial septum into the right and left atriums. The heart consists of two chambers on the fourth embryonic week, very early. Then formate the three chambers. Formation interatrial, сначала common, atriums and ventricles, потом interatrial septum isolates the atriums. The next it is four chambers heart, formation of the interventricular septum on the fifth embryonic week. During the development, the heart has change the shape. In first tubal as a vessel, then S-shape, then two chambers, third three chambers, and four chambers. Anomalies of the heart First, it is communication between the right and left chambers of the heart. Patent foramen ovale, то есть oval opening must close, no? It may be open. Ventricular septal defects, between the ventricles. Completely absent either interatrial or interventricular septum. It may be absent of the interatrial or interventricular septum. Common atrioventricular orifice. These are anomalies of the heart. Then for the anomalies of the heart, maybe anomalies of the vessels and anomalies of the chambers. Stenosis of the orifices. Stenosis of the left and right atrioventricular orifices. Stenosis of the orifices of the one or several veins, superior vena cava or inferior vena cava. Stenosis of the aorta or pulmonary trunk. Third, anomalies for the position. Anomalies of the position. Transposition of the heart. Heart lies inside the thoracic cavity on the left side. most position. It may be abnormal position. Dextrocardia. Dextrocardia on the right side of the thoracic cavity. High position. The heart during the development down from the neck region into the thoracic cavity with diaphragm. The heart maybe lies inside the on the neck region. Transposition of the heart. Dextrocardia, high position. It is same. It is same anomalies. That's the anomalies of the heart. Development of the arteries. Sources of the development on the embryonic period. There are pairs, ventral and dorsal aortas. Two aorta, ventral aorta and dorsal aorta along the embryonic period. 6 pairs of dial arterial arteries between them. Those ventral and dorsal arteries connected by 6 pairs of dial arterial arteries. During the development, first, second, and fifth dial arterial arteries reduce it. During the development. What we can see the embryon, development of the arteries. Origins or sources. Truncus arteriosus, it's just from the truncus arteriosus originates developments the aorta and pulmonary trunk. Ventral aorta, we can see on the ventral side, ventral aorta. Dorsal aorta on the back side, dorsal aorta. Descending aorta. Branchial arteries between the dorsal and ventral arteries. We can see the branchial aortas. Segmental branches of the descending aorta. Omphalomesenterical arteries. Let's apply the mesentery. Capillary network of the extremities. These are origins of the development of the arteries. We can see the ventral aorta. On the ventral side, ventral aorta. Dorsal aorta. Between them, segmental branches, segmental arteries. 6 segmental arteries connect this aorta. Let's reduce the 6, 4, and 3rd. Dial arteries. Restructuring of dial arterial arteries. The 3rd dial arterial arch, from the 3rd dial arterial arch, forms the common carotid arteries. Right from the right 4th diel arterial arch from the right fourth diel arterial arch formates the brachiocephalic trunk. Brachiocephalic trunk. From the left fourth diel arterial arch formates the aortic arch. Formates the aortic arch. И 6 right and left 6 diel arterial arches from the 6 formates the right and left pulmonary arteries. Pulmonary arteries. Common carotid artery from the third. We have right and left common carotid arteries from the third. Brachiocephalic trunk from the right fourth. Aortic arch from the left fourth. И right and left pulmonary arteries from 6. From the right and left 6 diel arterial arches. Arterial arches. Так, значит, sources of the development of the veins. Sources of the development of the veins. Значит, we know the superior vena cava, inferior vena cava, and portal veins. Portal veins. И, значит, their sources, значит, there are anterior cardinal veins of the fetus, of the embryonic period, anterior cardinal veins, posterior cardinal veins, posterior cardinal veins, common cardinal vein, between them formates common cardinal vein, и inferior vena cava development from the primordium of inferior vena cava. Inferior vena cava. There are 3 sources of the development of the veins at anterior cardiac veins, cardinal veins, posterior cardinal veins. They connect to each other by common cardinal veins. Between them is common cardinal veins. И inferior vena cava formates from primordium of inferior vena cava. Inferior vena cava. Differentiation of sources of the veins. From anterior cardinal veins, development internal jugular vein, subclavian vein, and brachiocephalic veins. Posterior cardinal veins, from the posterior cardinal veins, originates development azygous and hemiazygous veins of the posterior thoracic cavity. Posterior thoracic cavity. Lower part of the posterior cardinal veins. From the lower part of the posterior cardinal veins developed the common iliac arteries. Common iliac arteries. Veins of the internal jugular, subclavian vein, brachycephalic veins from the anterior cardinal veins. From the anterior cardinal veins. Azygous and hemiazygous veins along the vertebral column. They lie along the vertebral column on the posterior thoracic wall. They development from the posterior cardinal veins. Posterior cardinal veins. And common iliac veins, which form the inferior vena cava, originate from lower part of the posterior cardinal veins. And anomalies of the arteries. First, communication between aorta and pulmonary trunk. They originate from the truncus arteriosus when they don't isolate. It forms the common truncus arteriosus. Aorta pulmonary fistula. Connection between the aorta and pulmonary fistula. Patens ductus arteriosus. То есть connection between the pulmonary trunk and descending aorta. Bartholin's duct. Anomalies of the aorta. Double arch of aorta. Dextra arch. High location of the arch. Double ascendance and double arch of aorta. Maybe coarctation of aorta. Anomalies of the variants of the branches of the arch of the aorta. That from the aorta originate 3 branches. Это brachiocephalic trunk, left common carotid artery and left subclavian artery. Maybe dextrocardia, it is development of the heart with aorta, it may be on the right position. High position, aorta may be on the neck region 2 as heart. These are anomalies of the aorta and pulmonary trunk. These anomalies of the precardiac, vessels. Thank you for your attention. I can see the